child is tongue-tied, they're going to find it very hard to posture the tongue correctly in order to latch correctly. So they've got to compensate. So when they compensate, they might have to suck harder or use different muscles, or if the tongue can't cover the pad which is on the lower jaw, that's very grating on the mother's nipple. So it can cause great trauma to the mom's nipple. It can cause cracked nipples, even bleeding nipples. But some moms are so determined to breastfeed their children that they put up with it. It's a tooth clenching experience, I assure you. I've had so many moms in here that actually had to do that or wanted to do it when, if the tongue tie and or the lip tie had been addressed, they would never have had to have suffered. The baby's swallowing isn't great. So very often as they're compensating, they're gulping a lot of air. So they end up with, cramping tummies and colic. They become colicky babies. They can get very frustrated at the nipple that they're just not getting the delivery of milk because they're not able to stimulate the breast sufficiently to get the right delivery of milk. And they can get exhausted. They can just end up being very cross babies. There's an awful lot of trauma that they experience that in my eyes they should never have to experience, because they're not meant to be tongue-tied. They are not meant to be born with these tethered oral tissues. That's the bottom line. They're not meant to have them. They're meant to all have dissolved by week 12 in utero. Some mums will put up with these very, very difficult situations for weeks and weeks and weeks. And as the weeks are going on, it's getting more and more difficult to address and revise the tongue tie and or a lip tie as the baby is getting older. So the earlier they anticipate that there might be a problem, the easier it is to revise the little baby's tie. Any of the tethered oral tissues, the easier it is to revise them. But I sometimes get moms ringing saying, my baby is 9 months, I'm still breastfeeding. I have just, I've done my best. It's been very difficult, but I think they're tongue-tied. What should I do? And I unfortunately have to say, almost at that point, really, nobody is going to try and release that tongue tie now, because you've a 9-month-old baby who really knows what's going on, and you're not going to be able to give them any kind of local anesthetic or numb the area or do anything like that, and you're not going to put them in for a general anesthetic at that age, because the research now shows really that you shouldn't give a general anesthetic to a child under 1 unless it's very, very important. But that's an area that needs to be addressed as well, because if we go on that research paper from Dr. Christian Guilleminault, and he says that if that is the phenotype which presents this short lingual frenulum, and there's a 48 propensity to have obstructive sleep apnea, sleep apnea can kill you. So I think you're much better off having your little general anesthetic for the 10 minutes and addressing the tongue tie in children under 1 if sleep is an issue, if obstructive sleep apnea is presenting. Generally moms do, but there's a point that very many people are missing. They will go somewhere and they will realise, or they will be told that there's a tongue tie, and the tongue tie will be revised, it'll be released. And then most moms, when they put the baby to breast, the baby is actually able to feed, and there's a huge difference. There could be a huge difference in the baby's ability to feed and the comfort level, and you end up with a very happy baby, and happy babies equal happy moms. But if there's a lip tie there and that hasn't been addressed, the baby still won't be able to latch onto the breast properly, because they just will not be able to flange that lip up and hit the right part of the breast to actually suckle correctly. So they can still have a breastfeeding problem, and that's The big issue that most people forget, they say, oh, I got the tongue tie released, it didn't do anything. But perhaps there was a lip tie there that hadn't been addressed, so baby still can't latch properly, hence can't feed properly, and now it looks as if the revision of a tongue tie is the culprit, that revising it just didn't do anything. And people really have to watch out for that. I think everybody knows the age-old content of breast milk. You know, you get mom's immunity, all the nutrients that the baby needs. You can build up a relationship because the baby is just at the right distance away from the mom when the baby is feeding. So you can build up that relationship. But a lot of people don't understand that there are many other elements in the milk. Take, for example, a substance called hamlet, which is active against over 40 different cancers that the baby is getting into its gut. And breast milk also helps to seal the baby's gut, so it reduces gut issues, leaky gut issues down the road, and that's really important. The biggest benefit of breastfeeding is facial physio. And that is when the baby is breastfeeding, the tongue has to posture itself in a certain way, so it's constantly, like a piston, it's pushing up and down against the palate, it's moving the palate, and that movement we refer to creates bone growth in a process which we call mechanotransduction. And that movement actually encourages, just along those suture lines, those little lines along the palate and in between those 6 bones, and it encourages those stem cells to be converted into bone cells, so new bone is laid down and baby's face grows. And that stimulus is activated every time mom breastfeeds. So if mom breastfeeds, every 3 hours, baby's face is brought to the gym 8 times a day. And if mom exclusively breastfeeds for 6 months, how many times do baby's muscles get worked in their facial physio regime? And that really grows baby's face. You're growing the face away from the airway, so you're absolutely enhancing airway patency, which means you've given them the best option of sleep, good restorative, non-fragmented sleep. And when a child is sleeping, you are healing them at 4 different levels. You're healing them at a physical level, an emotional level, a cognitive level, and a behavioural level. So why wouldn't you want to give your child that? You do not have to work at bottle feeding. The milk just falls into the mouth. So baby's face is not brought to the gym. And that's why we use a difference in terminology. Breastfeeding is suckling, that's your facial physio. Bottle feeding is sucking. Paleolithic man would have always breastfed, and it would have been exclusive breastfeeding for 6 months. And I think we all know that a child's or an infant's teeth begin to erupt at around 6 months. And it's almost like Mother Nature planning all of this. The child is getting teeth in and around. There's a dropping off in breastfeeding and a development of teeth to start a chewing exercise. And chewing is the only exercise that will grow the lower jaw. So we're moving from one form of exercise, as in facial physio, going to the gym 8 times in a 24-hour period, to moving across to these chewing exercises. When the tip of the tongue sits at the spot, the little nerve endings there are activated and a little message is sent right up to the brain, and we get the release of endorphins. So tongue function in the roof of the mouth, starting from the spot here right back, has a huge impact on the way your endocrine system might work, on the way you're draining the lymphatic system, particularly the adenoids and the tonsils. And when you get that soft palate working, you're tweaking the eustachian tubes, so you're draining your ears, and collectively you're really improving the workings of your ear, nose and throat area. So you're going to have a very healthy ear, nose and throat area, and you won't be presenting with as many nasal problems or throat problems or ear infections when that tongue is working properly. And I think that's magic.